Dr. Danister Perera had been the advisor for Japanese Association for Promotion of Ayurveda, Herbs International, Holy Medica, Netherlands. He took MPhil in ethnobotany from University of Kelaniya. He had published many articles based on international research studies like Jwara Gayatri Mantra as an evidence for tantric influence in the indigenous medicine, etc. He had been the member of Memory of the World, UNESCO, National Library and Documentary Services Board, had been the resource person in the Ministry of Indigenous Medicine. I invite Dr. Danister Perera for briefing this session.
I'm from Sri Lanka, which is the well-known country, India, because we are called the pearl of the Indian Ocean. And we are sharing very much similar culture with South India. Therefore, I don't need to give a long profile of the country, but in my presentation, I'm very much focusing on the Sri Lankan traditional medicine. First of all, I would like to thank the organizers for inviting me to deliver the speech on the Sri Lankan traditional medicine, and thank you very much. And I think that you will find some very unique features which are only inherited by Sri Lankan traditional medicine, sometimes which is not found in classical Ayurveda. But sometimes you will find these features in the state level local medicine. But the Sri Lankan traditional medicine, I would rather like to call it indigenous medicine in Sri Lanka. We will have still in our legal context, we have given a very due place for that, due recognition for the indigenous medicine in Sri Lanka. Next slide, please. I would like to start from the current status. Sri Lankan traditional medicine is legally recognized by the Sri Lankan government under the Act, which is called Ayurveda Act, by the name of Deshiya Chikitsa. Then professionally, the traditional practitioners are recognized for the registration. They are given the registration for practicing medicine apart from the graduates. We have two kinds of practitioners. We have general practitioners as well as we have the unisectional practitioners who are only practice one section of or one branch of Ayurveda or one branch of traditional medicine. Then also very important thing is we have included traditional medicine into our BAMS curricula, where the BAMS undergraduate should cover 200 hours of learning indigenous medicine, Deshiya Chikitsa, in 4th and final years. Then also in the internship, they have to go through 3 months training under a traditional practitioner to complete their internship. This is also very important. We have special kind of evaluation carried out by these internees after the training. Then technically, the competencies of the traditional practitioners are accepted in the research and clinical interventions, where we have employed some eminent practitioners, traditional practitioners in our hospitals for special clinical interventions, especially the orthopedic and the snake venom treatments and the burn treatments, these kind of things. Pharmaceutically, some preparations coming from indigenous medicine are included in the National Ayurveda Pharmacopoeia. They are accepted as formal formulas. Especially culturally, the traditional medicine or the indigenous medicine is established as a cultural repertory or a heritage of indigenous knowledge among the people. Next, please. History. History is very interesting. Interesting history we have. We have two kinds of history. One is archaeologically proven, evidence-based history, which is well known and well researched. Somebody can go to the internet and search. If you put ancient hospitals, the first country will come, the Sri Lanka, ancient hospitals. We have many archaeological evidences where the ancient hospitals have been established by various kings in various periods from the 4th century. But I'm going to actually highlight here another thing where we all know this story about Ravana. Because people always think in Sri Lanka, they have a cultural belief that Ravana is the forefather of the Sri Lankan medicine, but which is not archaeologically proven. But people still think that the Ravana is the founder of Sri Lankan medicine, and the Pulasti is the sage who was the expert of Sri Lankan medicine. But if you go through the history or the literature, we have not found any kind of a text which was written by Ravana. But there are 5 texts listed and believed to be written by Ravana: Arka Prakasha, Nadi Prakasha, Uddishtantra, Shivatandam, and Nadi Prakasha. Kumaratantra. Kumaratantra, Nadi Prakasha, Arkatantra, Uddishtantra, and Shivatanda. 4 out of these 5 texts are considered as medical texts. Then, apart from this belief, now this is actually, I heard there is a text called Ravana Samhita also, but I don't know whether it belongs to Ravana or maybe recently written. Apart from this Ravana story, there is a pure indigenous medical system which is called Yaksha tradition. Now we have 3 kinds of traditions. One is classical Ayurveda, and other one is classical traditional medicine, which is theoretically based on Ayurveda, and pure indigenous medicine, which is called Yaksha, with Yaksha medicine, which is descended from Asura civilization. The people still they practice at rural areas. In rural areas, they have very unique formulas and very unique kinds of treatments which belongs to this tradition. Next, please. Therefore, I would like to present Sri Lankan traditional medicine into 4 epistemological contexts. First one is classical Ayurveda, which is taught in universities, which is actually which had come from India, classical Ayurveda. Then the next context is classical or the formal traditional medicine, which is documented and printed and published based on Ayurvedic theories and mixed and blended with some indigenous concepts. The third context is indigenous medicine, which is extracted or which is excluded from Ayurvedic theories and based on purely indigenous concepts. The fourth context is ethnomedicine, which is being practiced by the normal layman society, which is very dynamic and which is changing and always updated by the other parallel systems. Now, this is the outlook of our formal traditional medicine. We have indigenous knowledge, and we have Indian Ayurveda, Siddha and Unani, and all together it makes the formal traditional medicine in Sri Lanka. Next, please. Again, I would like to highlight the Ravana story, where it is very controversial source, because Sri Lanka is known in ancient times as Sihala Deepa, which had become Serandip, then it became Ceylon, Ceylon and Ceylon. It was the ancient name, Sihala Deepa. There was no Lanka actually. The Lanka is not located in Sri Lanka in ancient times. Then it was inhabited by Yaksha clan before the Buddhism is introduced. That's why the Yaksha tradition is believed to be descended from the prehistory. And about the texts written by Ravana, then some scholars, they believe that the Ravana is not a mythical character which is mentioned in Ramayana, but it is a tradition, not a person. It is something separated from Ramayana. This is a tradition. Ravana is a tradition in Sri Lanka. That is kind of a scholarly opinion had come recently. Next one, please. And we have indigenous texts, some indigenous texts which are actually published already. Sarartha Sangraha, it is in Sanskrit. Yogarnave, this is the first local language text. Besaja Manjusa, this is the only medical text in the world which is written in Pali, stanzas. Jo Varayoga Sare, this is all books. We have printed versions, and there are some books we have transcribed from the manuscripts, family manuscripts, and they are also printed in volumes. And there are some small sectional booklets which belongs to some branches of the medicine. Next, please. Now, these are the family manuscripts we can find in the custody of research institutes, universities, libraries, as well as in the private libraries. Now, if you see the below pictures, these are belong to one doctor. Some doctors, they have hundreds of manuscripts coming from their generation. Next, please. I told you that the only medical texts written in Pali, we are proud to have. The Sri Lankans are proud to have the only medical text written in Pali. 60 chapters in Pali language, that is called Besaja Manjusa. The UNESCO has accredited, recognized this as a national heritage. Now we have proposed this book as a world heritage actually, because this is the only book in Pali language, and this book has many unique features. It has 60 chapters, but there's no chapter on gynecology, no chapter on pediatrics. This is written by a monk, Buddhist monk in Pali, and we think that this is a handbook only for the monasteries. That's why this is in Pali. Okay, next please. These are some figures quoted from, this is Marma, or the what do you call this, Vedana Chikitsa. The points are located. Next please, next please, next please, next please. These are some instruments for Vedana, and they have described it should be made with the different lohas, different metals. Next please, next please. And also we have the good, very wider field, wider knowledge on the elephant medicine also. And we have different sections in our traditional medicine. Some major sections are general and the eye diseases, orthopedic, snake venom, mental diseases, boils and wounds, and burns, and hydrophobia, and the puncturing and cauterization. Then we have minor sections. Penis, Sutika, I think you can understand. Atisara, Arshas, Kandamala, Balaroga, Jwara, and this jaundice and poisons. Now there are generations we have, special families, family lineage who are specialized in these sections, these branches. That is the beauty of traditional medicine. We have the families who are actually descended from the maybe about 20 generations practicing the same medicine branch. Next, please. And there are concepts which are very unique to the Sri Lankan medicine, which are sometimes apart from Ayurvedic theories. Now we believe the three doshas, but apart from three doshas, we believe karma. Karma is also a cause of the disease. As our Cambodian friend said, that dharma therapy, like that karma is accepted. And the divine affections and some demonic affections, and also the buildings, the Vastu dosha. Vastu dosha is also considered as a cause of diseases. And black magic and krimi. Panu dosha is the krimi. Krimi is very important because in Sri Lankan medicine, there are 80 families of krimis. 80 families? Yes, 80 families. In our books, they are described how their movements and their appearance, everything is described. I will tell you one example. Normally, we call one worm which can cause the infertility. It is a special worm can cause infertility. That is a worm disease actually, according to indigenous medicine. Then other concept is we call tundus bandima, is the people, in some diseases, the three doshas can be confused with the effect of external factor. It's like avarana dosha sometimes, but there are some methods prescribed to clear them. And this is not panchakarma. This is something doing with rituals, how to clear the doshas. Then vireka is virechana, but in Sri Lankan terminology, vireka has a different meaning. You can do virechana for vamana is like virechana, and you can do vireka for the eyes, you can do vireka for the uterus, you can do the vireka for any organ. That is one concept. Next, please. Diagnosis. In diagnosis, the pulse reading is very important, but in our pulse reading, there are some books. They have described different reading techniques and also different movements and many combinations other than the three doshas. Indriya Pariksha, we have different diagnostic techniques where the patients, when the patient comes to the practitioner will light a lamp with some medicinal oil. Then they ask patient to look at the lamp flame and ask what is the color of the flame, how many flames you see. These kind of diagnostic techniques are applied. Then also we give some medicines and ask patient to describe the rasa, the taste. Now in indigenous medicine, there are about 10 kinds of taste, not the six taste, more than 6 tastes described. Horoscope reading is a part of medicine. It is also another special thing. Next, please. Classification and nomenclature. This is also very important because classification, if you see classification, now penis. Now in indigenous medicine, there are 18 kinds of peanuts, 18 kinds of different peanuts. All the peanuts, the types are named and described. And Grahani, so on, there are different. Now, I have given only examples, but most of the diseases, they have different classification system, different nomenclature. Next, please. Now, from here, I will take you through a pictorial journey. You can see the practitioners, when the patient goes to the practitioner, if the traditional practitioner, if you go to the traditional practitioner, it is mandatory to take beetles. This is the way they go to the doctor, and they don't look at the fee, but they look at the beetle leaves. That is the respect. This is the first sign of the relationship, doctor-patient relationship, beetle leaf. You can see how much beetle leaf on the table. Then we have about around 3,500 flowering plants in Sri Lanka. 60% of these flowering plants are common with the Western Ghats or the South India. We have 25% of plants are endemic to Sri Lanka. Sri Lanka is a biodiversity hotspot where we find more than 900 endemic plants to Sri Lanka which are not found in anywhere in the world. In our traditional medicine, most of these endemic plants are used for medicine. Therefore, this is not an endemic plant. This is not an endemic plant. This is the plant which is called Konthalam. I don't know it is coming from which language, Konthalam. This plant is only found in 5 locations in Sri Lanka. 5 locations, only in sea, a coastal area, southern coastal area. This is not grown in Sri Lanka. This is not an indigenous plant, but we have one very important prescription formula made out of this plant. This is Gopalugulia. Gopalugulia is very famous in southern area. This is only unique to that area because of this plant. This is something very important, how the Sri Lankan people have domesticated something which had been come from another country, because this plant only can be found only in the southeast, Malayan and the Cambodian, Vietnamese area. Next, please. Next important thing is, this is actually I quoted from British Medical Journal. This is an article published in British Medical Journal on the Sri Lankan Sunni mask. We have 18 Sunni masks, the mask which are used for the devil dancing, for the healing rituals. They have studied most of the features of the Sunnis are representing the diseases, especially the Vata Rogas. They are representing the diseases. 18 types of diseases represented in the mask. Next, please. These are many masks used for the rituals, healing rituals. Next, please. And we also have the healing rituals which are very associated with Buddhist practices, Buddhist healing practices. You can find the Bodhi tree, sacred Bodhi tree is also another very important in medicine, where the people do votives for the patients who are suffering from chronic diseases to get the beneficial effect from the healing powers of the sacred tree. And talismans, and you find some kind of ritual structures. Next, please. We have different kind of preparations We also use some decoction and all these things, but apart from these main preparations, we have other kinds of preparations, especially which are unique to Sri Lankan medicine. I will tell about one treatment. I will take the pandam. Pandam is a kind of a medicinal torch or medicinal flame. We make medicinal oil, and we actually make medicinal oil mixed with some medicinal paste and take the flame, and it is a heat therapy with the flame. And also there are some medicinal oils, we make the lamp out of it and keep in the space of the patient or in the house to expel the germs or some whatever it is, expel the bad effects. Next, please. These are medicine caskets. Next, please. Now, this is another special treatment, tattoo treatment. Now, we have very few families who practice these tattoo treatments. Now, for this tattoo treatment, they take the thorn of the lime tree, then make a special instrument, fresh instrument, and they tattoo on the skin on a special location like marma or like marma therapy, and special symbols, and put some medicine. Then this is a treatment. And stack horn massage, lamp heated oil therapy. Next, please. Okay, this is another special event where the practitioners, when they start preparation of some medicine, they do protection. They do kind. Next, please. The collection of raw materials. Some raw materials they collect from the tree. Previous night, they have to go to the tree and do some rituals, worshipping, and keep one lamp. That is actually, they believe that most of the medicinal trees abided by the deities, divine beings. Before you harvest any part of that plant, you have to get the permission out of this divine being. Then only you get the full blessings of the properties, medicinal effect. Next, please. This is also again how they preparing the medicine. Next, please. This is their chanting Pirit before do that. Then this is lime cutting. I was talking about the clearing the ritualistic practice for the clearing the doshas, lime cutting, and they recite the medicine before given to the patient. Next, please. This is grinding six-sided grinding stone. You can see that six-sided grinding stone. Next, please. Next, please. Next, please. Okay. This is a special kind of preparation practice. We call it Agraraja Kwata, Agraraja Kashaya. Now, for this special medicine, they have to seal the pot and use only the cinnamon wood as firewood. Next, please. Cinnamon wood. Another special event. Previous one, please. Previous one. Now, this is a very famous eye diseases generation family, where you can find all these persons are patients or the guardians. They are working there, not the paid people. All the patients and the guardians, they are working. They believe that when the patients are taking part of preparing medicine, they will have a good effect, because they are touching and they know how fresh these medicines are taken and how fresh these medicine are, prepared, they have kind of a good feeling. Next, please. This is another place where you can find all these patients, they are working. You cannot find who is the practitioner. Can anybody say who is the practitioner? The practitioner is that lady. You can see that one lady there, she is the practitioner. Right? Now, all these medicines are collected and brought from the patients. And they brought it and they collected and they made it. Next, please. Now you can see they are covered, all these patients are covered their eyes. This is a special therapy where we treat the toe of the foot for the eye. The medicine is applied on the toe of the other side. If you have the problem in the right eye, the medicine is applied on the left toe. This is a cross therapy actually. We don't know what is there can be a kind of a tantra or ida pingala, something like that, nadi connection. But this is practiced and effective. And people get cured. This is the beauty of this treatment. Next, please. You can see how these people, they have collected fresh medicine and categorized them and keep them. And this is all done by the normal people who come to take treatment. Next, please. This is dried raw material collection in a practitioner's place. They keep most of the dried raw materials stored, which are actually used for day-to-day practice. Next, please. Okay, this is another very important Sri Lankan tradition. We have one family who make eyeglasses out of quartz. They believe that this has a medicinal effect. Now we have proposed to the UNESCO this practice to be inscribed as a World Heritage, which is very unique and urgently safeguarded, because this is in risk. Actually, this is something vulnerable because the next generation will not practice this. We have one old man who is practicing this still, and we are going to propose as an intangible cultural heritage of Sri Lanka by the UNESCO. Next, please. Only this man is practicing now. This is a very important medicinal craftsmanship. Now, these kind of craftsmanships are very important to be safeguarded in any country, because now these are getting vanished. Next, please. Finally, I want to show that how the indigenous system of medicine works and how it is utilized by the people. What is based on this? Now, the first level is self-medication. Self-medication is very important. Now, the information technology era, we are not consulting doctors. It was in the industrial technology era. We consult the specialist. First, now WHO encourages self-medication. First, you do something at home. It is very important. Because the society is over-medicated. Society is over-medicated, over-drugged. Everywhere you find drugs. Therefore, first thing is dematerialized therapy. Do something without anything. Without using any medicine. Even home remedy, don't use first dematerialized. Even if you have a good mantra, first try the mantra and see. If you want to pray, go to the temple and pray. First thing is that. Then the home remedies. Next, home remedies. Then only you go to the local healing, rational therapy, family physician, then you have teamwork sometimes. Then, if the treatment does not respond, what is next? If you have an incurable disease, if you have a terminal disease, what is the next step? You have to practice the life philosophy. This comes from Buddhism. Karma, dharma therapy, cultural care, religious aspect, actualization. These are very important because most of the people now, they are suffering from many kinds of terminal illnesses where the medicine cannot help them to prolong their life. In these kind of cases, these are very helpful. Sometimes they can improve the quality of life. This is very important. Sometimes the doctors have given up them. You cannot do anything, go home and eat anything because you are going to die. This is how Western doctors tell the patients, which should not be told. But by these kind of things, cultural care is very important. Ayurveda can do many things in these kind of things, these kind of alternative caring systems. That's why indigenous system of medicine, which is evolved from the same society, within the same community, is very effective because it is not an exotic system. Because the Ayurveda is also a standardized greater tradition. All over the country, all over India, all over the region is a one system. We have to go to the local traditions, local systems. Even in one country, now Sri Lanka is a very small country, but in our country, inside the country, within the country, we find many local traditions. We encourage people to practice local traditions, local health traditions. That's why we have included these practices into the curricula where the BAMS students should be competent in these alternative care systems because one day they will go to the community and provide a very good maximum care. Maximum care is the principle. Maximum care. Not just optimum care. Maximum care is the principle. For the maximum care, you should understand the community, you should understand the philosophy, life philosophy, community needs, and the local tradition. What is the philosophy and what is the belief system? Belief system is very important where the belief system can cure 50% of the patient. Belief system. This is proven by the scientific findings. Next, please. Thank you. This is my presentation about the Sri Lankan traditional medicine. Thank you for your attention. Thank you very much.